Hello, everybody. Good evening, good afternoon, good morning, depending on your geographic location. I'm Kevin Davis, the Editor-in-Chief of BioIT World, and delighted to welcome you to another in our fall 2009 series of web symposia on the topic of evolving EDC, finding e-clinical solutions. We are indebted to Adobe for underwriting this web symposium, which allows us to offer complimentary registrations and allows you to join us. And we hope that you'll stick around for the full 90 minutes of this broadcast, not only to enjoy what I'm sure will be three fascinating presentations from the CRO community, a leading academic cancer center, as well as our sponsor partner, the technology supplier Adobe, but also because you have the opportunity, as Barbara mentioned, to use the interactive Q&A capabilities of this platform. And as she said, please feel free during any of the three presentations to type your questions in during the presentations. We'll take as many of those questions as we can in the allotted time. So the goal of today's symposium is to provide three expert and complementary perspectives on the evolution of EDC and to discuss its implementation in the broader framework of e-clinical technologies and solutions. Many would argue, I think, that EDC is an indispensable component of running a clinical trial in the 21st century, and yet clearly not everyone shares that opinion. Its uptake is not as high as one might imagine for a technology that's had its proponents over the past decade or more. During the course of today's webinar, we think you're going to get a truly fascinating perspective of the strengths and weaknesses of EDC, the factors that go into selecting and deploying an EDC solution from the user side, as well as insights into how EDC integrates into a true e-clinical workflow. I'll be introducing three speakers. The third will be a presentation from Marianne Quinn, who is the president of Adobe's Integrated Submission Strategies division. You'll also be hearing from Marina Nilny, EDC Program Manager at the Dana-Farber Cancer Institute in Boston, who has fantastic experience in selecting and deploying and running EDC solutions. But first, delighted to welcome as our lead-off speaker, Michael Rosenberg, MD, the founder and CEO of Health Decisions, which is a leading CRO based in Durham, North Carolina, and if, as I hope you are, avid, loyal readers of eClinica, someone we've featured a couple of times in the course of this year. Health Decisions is a full-service CRO with 2 decades of experience in all major therapeutic clinical areas, managing phase 1 through 4 clinical trials. Michael's mantra is something called agile clinical development to accelerate clinical studies, embracing adaptive trial designs where appropriate, reducing costs and maximizing, the hope is, the patent life of the therapeutic in question. And based on our past interactions with Michael, we thought he would be a superb choice to open today's web symposium and succinctly present the good, the bad, and the evolution of electronic data capture. Michael, thank you so much for joining us today.
Thank you, Kevin, for the opportunity. I will also reiterate my thanks to Adobe for making this possible for so many listeners. So my goal this morning is it's this afternoon here already, but what I want to do is to give you an overall perspective of data management, and especially where it fits in to some of the efficiencies that we're now looking at